Welcome to the HCBiz show. I'm Don Lee, joined by my co-host Shahid Shah. Welcome to the show, sir.
Thank you. Yeah, we're going to have a good time today. We picked up on our 200th episode on a number of key ideas about how we can move into a more disciplined approach towards healthcare delivery organizations' innovation work. So even more innovation work is required nowadays, where we're seeing problems with human resources not being available. Too much technology is available now. We don't know which ones to pick. So yeah, I'm looking forward to this conversation for sure, to see how we can help our audiences figure out what the heck to do with all of these new technologies, plus the fact that there's nobody around to implement them.
Yeah, right on. If nothing else, now is the time to be much more efficient with your resources. This, of course, is not a new problem. And it's not a healthcare problem. This is across the board. Whenever organizations try to be innovative, try to do new things, there's a lot of people that got to weigh in. It's hard to pick what you're going to work on. We're not always really good at designing what's our metrics and how we're going to decide not just what we're going to do, but how we're going to know if we've been successful and all of that kind of stuff. And that's really what we're going to get into today here, talking about Medigy's healthcare delivery organization innovation lifecycle ontology, the HDO-ILO, which we normally say, which is why I don't trip on the acronym. That's what that's all about, is starting to do exactly what we introduced in episode 200. Starting here today, we're going to start digging into this concept a lot more. And today we want to start with just talking about what the heck is an ontology in the first place. So Shad, let's start there. What's an ontology? What does it do for us?
So an ontology in general science is basically a way to organize information. And so when you think about the most common ontologies we know are in biology. We all learned them when we were in school, like I am a human, but because I'm a human, I'm also a mammal. And because I'm also a mammal, I'm also an animal, etc. Right? So it's a way of categorizing things to better understand it. So we can say, all mammals do this and all humans do that. So when you think about it in our terms, and this idea of the healthcare delivery organization's innovation lifecycle, if we're going to do this in a disciplined way, we at least have to agree, what are we talking about? Like, what are the steps involved? How do you do things? So an ontology is basically a way for us to figure out, how do we represent, name, and define the categories, the properties, the connections and the relationships between, a bunch of concepts and databases and entities and those kinds of things. So the healthcare delivery domain already has a fantastic ontology in the biology, chemistry, et cetera side. So we know, for example, when we say healthcare specialty, we're in general knowing that we agree on the fact that cardiology is a specialty and oncology is a specialty. But when we say, for example, that we have AI in medicine, what do we mean? AI where? Is it for diagnostics? Is it for therapeutics? And so as you start to drill down further and further and further into why you want to do something, and we've discussed in a number of other interviews with successful startups and successful companies, that innovation is broken into three key questions. Why are we doing something? What are we doing? And then how do we do it? In general, the how is sometimes the least interesting at the beginning. It is the most important thing, because if you can't execute on the how do you do something, it doesn't matter. But when we're deciding on why we should do something, for example, reduce the amount of time that it takes for a medical record to be reviewed by a doctor on a specialty visit for a patient who has just been diagnosed with cancer. Right? We have now categorized a whole bunch of things before we even define the technology or the discipline about how we're going to do it. So number one thing to always think about is why we're going to do things. And that's really where the innovation lifecycle ontology should start, is how do you categorize the whys? Then the second thing we help categorize is, what are we doing? Like the case of, I have a medical device, which is a physical scalpel for a surgical room, is the what. Why I do it is for either for surgery or for something else, but what it is pretty clear. So when we're dealing with technology, we often say, this is an EHR. Great. This is a patient portal. this is a diagnostic tool in artificial intelligence for evaluating whether or not an image contains a tumor. Okay, that's great. That's the what. So what does it do should be completely separate from why we do it. Because if you merge the two, that this is where we often get into trouble because we don't know that we should separate the what from the why. Now, where we spend a lot of time, and we absolutely should, is in the how do you actually do? Do you start a company? Do you take something that another company has done, like take an Amazon Alexa and stick it into your surgical room? That's perfectly reasonable. That's the how, right? How did we end up using the Alexa for surgery so that a physician, when they want to know something, they can ask something in audio or video, and the Alexa responds back to them in a surgery, during the surgery, from the medical record or whatever. All kinds of cool things can happen, but if we don't separate the why from the what, from the how, then it becomes a problem. So that's really where to look at ontologies is, what are the relationships between all the concepts and the datas and the entities that we're talking about? And so that's really where we started, as you know, with the Medici innovation lifecycle ontology, is the start to lay out what are the big building blocks of why we should do something. And that's what we started in episode 200.
Yeah, right on. And when we started this exercise many months ago, talking about the ontology and everything else, my first reaction to it was that it was a bit academic. And it's not something I haven't developed something like this before. I haven't worked on something like this before. I've certainly used them, but I felt like I used these when I was taking computer science in college. Yeah. And I get it, but it wasn't something that necessarily excited me at first. But what you just described there, when you were talking about a couple of different use cases and just different modalities that we're working together in, is we inherently use all of this knowledge that's organized in our heads every time we interact with one another. And the big problem that we have is everybody organizes that information differently. And it's especially true if you're working with people whose expertise lies in a different area. So one of the things we talk about on the show all the time is health IT adoption or innovation adoption. When you get into that health system, you're trying to sell something, there's 10 different groups that you got to convince that you can bring value to them, or at least not hurt them or get in their way. And all of them are doing this, right? Like the finance people have their way of looking at things, and the operations people have their way, and the clinical people have their way, and the IT people have their way. And that's where I got really excited about the concept of this ontology, is if this can become a way where we can help all of those people speak the same language and talk about things in the same way, then I think we can help a lot of people. And that jumped out at me because that's what I feel like is one of the primary things I do as a consultant, is I go into a room and I listen to people talk and think they're agreeing with one another, and they're all nodding their heads and say, yeah, that's what we're going to do. And my job is to sit there and point and say, you guys aren't talking about the same stuff. You're all in agreement, but you're not talking about the same stuff. So I'm kind of forcing that ontology into the room. And that's what I think, that's where I started to get excited about this concept. So that's one of the big components, but that's not it, right? So you're defining all of the things, all of the terms to be used, how they interact with one another, but you're also defining who are the people and how do they connect with one another, and you're defining the shared language. So take us through some of the actual components of the ILO, the Innovation Lifecycle Ontology specifically.
Yeah, and this might be a great time, Don, for you to bring up the website where we're doing this kind of thinking out in the open. I mean, one thing to make sure that our audience doesn't accidentally think of is that somehow you and I, in secret behind the scenes, have thought through everything and are now publishing this. No, nobody actually knows what they're doing on the innovation space, because if you're truly doing innovation, it's usually very, very early in the cycle before everybody's using it. So just imagine like this website that's here that of course will be in the show notes. Think of this as a landing page for us to begin this conversation with the rest of the community. So it is an open publishing paper with the ability for people to send in ideas and incorporate what they're doing. Because one of the things that we want to do here is kind of lay out the frameworks and say, here's what we think as implementers in the field, as people who have started companies and sold companies and built solutions for many decades, here's what we think this should look like. But then we might have a case study that you could send to us and be attributed with, right? So if you said, hey, at my hospital, at my dental practice, at my specialty clinic, we've used this template pretty successfully on intake of an innovation. Fantastic. Let's put it up there, right? So this website that you're looking at here starts to describe, what is the innovation lifecycle ontology? Who is it for? What problems are we solving? And those kinds of areas. But think of this only as a framework to get your input. And so that was, really, really important concept here is that no one knows, like there are no experts in this. Anybody who calls themselves an expert in innovation is just lying to you. We are all facilitators of innovation. There are no experts in these fields. Doesn't matter how many books you may have written or how many you may have read, because the whole point of innovation is it's new. And so saying, I'm doing something new, it's just been discovered, but I've got 10 years of expertise on it, that's a lie, right? And so you want to be careful with that. Now, when you look at this site, it's being broken up into a variety of different areas. And so if you scroll down a little bit, Don, there's a picture in the middle of the page that starts to lay this out for you, like why is it useful? Who is it useful for? And then why should healthcare delivery organizations care to participate? And this is probably the biggest call to action is go to your organization, go to whoever might be the head of innovation. Sometimes it's the chief innovation officer. Sometimes it's the chief technology officer. Sometimes it's your chief medical informatics officer who might care about this. Bring them in so that they can start to help figure out, number one, who is supposed to lead all of this? That's the one thing we're trying to discover early on is this the job of the chief innovation officer to help drive the process and life cycle? And this term life cycle will become very important in a second as we cover that. But is there a innovation life cycle in your company? Who leads it? And so with these two questions starting at the beginning, so HDO-ILO stands for, again, Healthcare Delivery Organization. IL says Innovation Life Cycle. And that life cycle, the L in ILO is more important than the O in ILO, which is, it's not the important part is not the ontology. It's the fact that innovation is a life cycle. It's a process. It's just like in the medical community, anybody who says patient care is a thing rather than a life cycle has never done patient care, because there's no beginning, middle, and an end to patient care. There's just a cycle. Everybody's going through these loops. And so when you think about the life cycle, then you have to describe, well, what are the steps? And that's really where we introduce the ontology part of this to say, okay, the first thing we talk about is expectations. Like, what do you want to happen? What are the results you're trying to seek? This is a way of describing the why. Why are you doing something, right? Don, often, you talk about this in almost every one of our episodes is, don't tell me what you're trying to do, tell me why you're trying to do it. And so as you scroll further and further down into here, what you'll start to see is, well, if there's a life cycle, where is it supposed to begin? Now, we have made a heavily opinionated statement that an innovation life cycle should begin with expectations or why. You might say, especially audience members who have been doing innovation in multiple subject areas for many, many years, you might say, hey, Shahid, guys, expectations are nice, but we already know why we're doing everything, right? We're doing it for the health and benefit of patients. You may argue that the whys are already very well understood. And even in that way, I would argue with you that while you think they are understood, it goes back to the problem that Don was talking about, that where is it written down? Like, can everybody tell me? Like, can everybody?
Don't skip that step.
Talk about that.
If it's already known and everybody knows it, then that'll be a very easy step and you can get through it very quickly. So sit down and do that step and write it down, make sure everyone can sit in a room and look at it and agree. and then be sure they aren't, like, as I alluded to earlier, nodding their heads in agreement on something that means something different to them. So yeah, I agree. It's one that people believe they have locked down, but I see every day that they don't. So
Yeah.
big, important issue.
That's right. And then this begs the question of, well, hey, are you guys suggesting that we have one piece of software that does all this? No, innovation lifecycle is not a tool or a technology that you can buy, install, and then immediately start using, because it is mostly people and processes, not technology, that's going to drive you there. So if you start off and say, okay, well, what problems are we trying to solve with the innovation lifecycle ontology? Number one is identifying the opportunities. Are you looking for efficiency, time saving, productivity? For example, safety. Sometimes, especially this happens more in healthcare, avionics, nuclear, other areas where we don't care how expensive something is. We care whether we might kill somebody or not. So if in a consumer-based industry, retail, et cetera, you say, well, we need to implement this technology to make something faster or cheaper, that may rarely be the case in healthcare. The first thing we care about is it going to save somebody's life? Is it going to extend somebody's life? And cost and efficiency is usually less important. So then when you say, all right, so tell us, what is it you're trying to accomplish? Then the second item you see here is feedback from the patient. So again, very complicated in healthcare is the fact that we are an intermediated industry, which means we have to have some even if you have a brilliant idea, if you don't have a reimbursement code for it, it just doesn't matter. So let's say you came up with the best technology in the world to identify skin cancer very early through your mobile phone. Fantastic idea. Everybody loves it. But you did not work through how that diagnostic will be reimbursed by insurance companies or delivery organizations on behalf of delivery organizations. Your technology may not succeed. So you got to figure out, how do you get feedback from patients? How do you get feedback from insurance companies and those kind of things? So as you start to read through this, I mean, obviously, when audience members, as you get a time to read through this, read and tell us, hey, you got this right. The direction is okay. Or no, you guys are focused on the wrong thing. And we want to hear, the more you tell us we're wrong and be heavily opinionated about it, the better we feel, because it means you actually read the darn thing. If you just say, hey, love the idea of the ILO, you know what that usually means? You probably didn't get a chance to read it.
Didn't read it, but I respect you, so I'm going to assume it's good. Yeah, no, I'm right on. And then you said it earlier, is that this is the first crack at it. This is not like a published, like, here it is, go do this and enjoy it. We took the first crack at putting this together for the community. Please come in and start helping us make it better. And I think, we got to keep reiterating that point throughout. So number of problems that we're looking to solve here. Let's talk specifically about this question, because this is an important one. You mentioned it earlier, is like, why should an HDO care about this? Why should somebody pay attention to this? I've got work to do. I've got things I'm already, innovation projects going. Why would I want to stop and take time and play around with your site here and your ILO?
Yeah, and the number one reason is because it saves time to get beyond the BS. So what often happens, especially in innovation, because no one knows what they are doing, no one wants to admit that they do not know what they are doing.
Right.
Normal human psychology is, if you and I don't know what we're doing, the last thing we're going to do in a meeting full of other smart people is to say, guys, I don't understand what innovation is. I don't understand why we're doing this. I don't understand what technology we're looking at. I don't understand how we're going to implement this. So what does everybody do instead? They sit and say, well, I read this on a blog post. I read this in Harvard Business Review. I did this and I did that. And there's no process being defined. There are no outcomes being defined. Success metrics aren't there. Key performance indicators aren't there. Objectives and key results aren't there. And so why we should care is because an ontology, especially a lifecycle-based ontology, if it doesn't immediately attract you and say, oh my goodness, now when we sit in a meeting, we at least have an agenda, right? So we're in a, quote, innovation meeting. The agendas are all haphazard. Nobody knows why they're supposed to be invited. A general rule. Sundar Pichai at Google made a general rule last year, but when he joined back in 2019, that their objectives and key results will move from quarterly to annual. Google's a bigger company, so they move from quarterly to annual. Normally, you do objectives and key results on a quarterly basis. Well, what did that define? What that defined was that Sundar, as CEO, cares more about long-term innovation rather than short-term innovation. I bring up that example because if your leaders are not making these decisions, it means they're leaving it up to you, probably accidentally because they don't want you to make these decisions. But because they didn't give you a process, they didn't give you a life cycle, they didn't give you questions to ask in your meetings, they're expecting that you're going to find these things out. So this is why having a community, like imagine you had 10, 50, 100 chief innovation officers or people participating in innovation, sitting around, agreeing on things, if nothing else, an agenda of what to discuss in meetings. That's like the minimal thing that we're delivering here.
Yeah, right on. I love the point there. If leadership does not make it clear what the organizational goal is or what the organizational posture towards innovation is, then they're leaving it up to you, but they're also leaving it up to all of your teammates. And again, that's instantly creates misalignment because everybody will think about it differently. I'll come in. I think that long-term is the most important thing. And Shahid's coming in. He's focusing on short-term because he's trying to, kind of move the needle and make sure that that's visible and everything else. And then Shahid and I are immediately not in alignment, and everything else after that is going to suffer. So yeah, I think that leadership defining what is the goal and, quarterly versus annual thinking like that is super important. And again, the ILO is not going to tell you that it should be annual. We're not even saying annual is better than quarterly. We're saying that clarity is better than not clarity. And I think that the ILO, that would be the aim, is to help you go through help you identify the things. What are the things that require definition, that require that clarity, so that you can help get your team on the same page and everybody working for the same things.
Right. And here's another quick call to action, which is if you've used agendas in your innovation meetings, especially those of you that were hired into that role, for example, you're a chief innovation officer, a chief information officer, you came in and then you had to implement something from scratch, meaning processes, procedures, life cycles, etc. What did you do? Did you get a paper from Harvard Business Review and use that? Tell us about it so we can start saying, hey, this was done by Hospital ABC in New York. This was done by Hospital ABC in Vermont. And therefore, these are good examples of what you should do as well. So as we introduce these topics, especially over the next few episodes of HCBiz, that's really what we want. Is we're begging, we're asking and begging the community to say, what have you used? And when we do it together, by the way, no one team has to know everything, right? If you happen to be an expert in expectations, while someone else has done a really good job on how do you define a KPI or a key performance indicator, fantastic. We'll just get together, put the two up together, and then we'll work together on how to align this. There is no right and there is no wrong. There is just existing and missing, right? So if we're not doing a life cycle in a affirmative, strategic, well thought out way, that doesn't mean we don't have a life cycle. It just means we have a life cycle that nobody's documented and nobody knows.
Haphazard, non-repeatable, non-measurable life cycle is what you have. Exactly. It's a bit of chaos. So, as we go through here in the coming weeks and really months, we're going to continue to pursue this topic and develop it. And as Shahid said, please come in, give us feedback as the topics are coming up. If there's something that you've done that's worked really well or something that you do that works really well, bring it to us. Like right now, something we'd be interested in is how does your innovation team very early on create that alignment around, the overall strategic vision and direction of your innovation cycle in general within your organization. If somebody has that type of clarity, let us know. Come on, we'd love to have you come and be part of the show, share what you've learned with the community, and kind of set the tone too, because that's going to get other people to come up and share things that you'll benefit from down the road. So as we go through this, on the left hand side, if you're watching, obviously if you're listening to this on the audio podcast, click the link down in the show notes. You can check all this out. But we have a breakdown here on the left-hand side of the screen, Shahid. This is basically going to be the starting point of a lot of our discussions for the next upcoming couple of weeks and months. What are the challenges that prevent innovation from happening? We talked a bit about them today. We'll get into that in a little more detail. What's the overall objective of the ILO? I think we've made that pretty clear. It's just to make this more predictable, repeatable, measurable, something that you can build on success, build on, shared learnings from things that maybe weren't quite as successful. And as we get into the assets section of this, that's where we'll break down all of the various materials that have already been produced, at least first crack produced for discussion and development of all of the different tools that do in fact make up the ontology, and where we're going to go from here. So any kind of closing thoughts on this as we just set up our upcoming series here, Shahid?
Yeah, one other ask is for those of us who are programmers or builders of systems, there is a place on the platform where if you said, hey, Don, Shahid, I found these 10 things that seem very repeatable across dozens of companies. Can I get an app to be able to be interjected here? Yes, absolutely. Like if you've built something and you want to present it to the people who are potentially using this. So when I mentioned that the HDO-ILO is not a tool that you can install, that is a true statement, but that doesn't mean that a particular checklist or a particular sequence of steps cannot be automated or cannot be coded. So if you guys feel, as you're listening to this, that, hey, it sounds like these 5 steps are the same for all hospitals. I'm a programmer. I just threw this utility together. Imagine we already have a platform where you can install it. And if you need to make money on it, you can, right? So imagine that you listened to what we were talking about, came up with an innovation around how to manage innovation. That's okay too. Drop it on here and sell it to the community's participants as they were here. So when you read through this, think of this as 2 principal purposes. One is that we're all getting together to try to solve these very, very difficult problems over the next coming decades. But 2, if this spins off and gives you some ideas about something to build a business around, make some money on, absolutely come, because we need these tools and technologies if anybody can think of a way to make it repeatable.
Yeah, right on. So that's what it's all about. Just getting the community engaged, getting everybody talking. Let's share and learn from one another. Obviously, you and I have a ton of our own experiences that we'll be able to lend to this, but we can only tell you about what we've experienced. So for this all to work, we need you all engaged. Reach out, email us, hit us on Twitter, LinkedIn, wherever, and let us know where you want to go with this. Let us know how you want to participate. We want you here. So Shahid, thanks for taking us through the origin of the ontology and the goals here. And to you all watching on YouTube or listening on the audio podcast, thank you as always for coming to learn with us. And we look forward to just digging in more and more with you in the coming weeks and months. So you can check us everything out at thehcbiz.com. Links to the HDO-ILO down in your show notes and descriptions. And we will see you next week.